Hi guys, this is Rick. This one we're going to do the initial approach to patient assessment. First of all, you want to do a scene size up and initial assessment. So we're going to be sort of looking at the scene safety and also giving a ethane. So the exact location, type of incident, any hazards, the access point, and number of injured, and also any other emergency services that are required. Alright, so we're going to utilise standard precaution and apply PPE that is appropriate to the scene or to the actual incident. Then we're going to go and get a general impression. So general impressions of the patient, they're just laying there, are they unconscious, are they alert, are they having breathing problems, are they in the tripod position, or sort of can they speak between words and that sort of thing. Okay, so we're going to also assess responsiveness. So like, are they alert, are they responding to voice, pain, or are they actually unresponsive? Okay. Then we're going to sort of like also look for any obvious life-threatening, so any life-threatening hemorrhaging or any sort of thing that sort of could cause major injury or either further injury, things like C-spine, that sort of thing. Now we're going to sort of like have a plan of 360-degree around your access around your patient, so that way you've got a good working area. So if they're in a toilet or something, you want to actually get them out of the toilet, and so you can get full access around them. Alright, and also if they're conscious, gain consent. Legalities these days, so like you can't really touch them until you actually sort of say, can we help you? And if they say yep, no worries. Well, if they're unconscious, it's going to be implied consent. So then we'll get in and start treating. We're going to check the airway, assess if it's open and it's clear and it's patent. Right, and if required, suction. In the case of CPR sort of thing, or if they're unconscious, we're going to look at also doing an airway if required. Also, we're going to look at the breathing. You're going to assess their breathing, so like as in like the rate, rhythm, and the effort. Are they using ancillary muscles, or are they just sort of breathing like I am now? So, or are they really struggling to breathe? All right, and then if required, give them appropriate oxygen, depending on sort of like their saturation levels and that sort of thing. Checking their circulation, identify any control any bleeding, particularly any life-threatening bleeding. Make sure you do that right at the very beginning. Any hemorrhaging that's uncontrolled or catastrophic bleed. With the breathing, also we're going to auscultate the lung fields in 4 different places. Right. Now actually sort of see if there's any crackles or wheezing or anything like that. Okay. Assess pulses for rate, rhythm and quality, either the radial or the carotid pulse, or both, preferably be both. And also assess their skin colour, temp and condition, so like they're pale, they're cold, they're clammy. Then look at sort of what we're going to do with the patient. Do they need transport to the nearest trauma centre or to the nearest hospital, or are they able to stay at home with a referral or other advice? Are they stable? Are they unstable? Or are they potentially unstable? And call back if you require it. So if you're looking at transporting and you've got a major case, you want to make sure that you've got a backup from an ICP or ECP or retrieval team if required. Disability, looking at their GCS, their pupils. If they got a GCS of 15 or a GCS of 3. If their pupils are dilated, fixed, or unresponsive or unequal. The grip strength and foot strength. So see if they've got motor and strength in the hand knees and their feet. At this stage, we're going to expose the patient and make sure there's other, see if there's any other injuries. But also, you want to consider modesty as well. You don't want to sort of have a patient that's in the middle of a football field, a young girl, and sort of strip her totally naked. So you want to have some decency and sort of have a modesty about what you're doing and a bit of common sense. Identify any head, chest, pelvic, or extremity concerns. So you're basically doing a head to toe, finding out other injuries and treating as required. Note the need for vital signs: BP, pulse rate, respiration rate, SpO2, a BCL, temp, and ECG, either 4 lead or 12, depending on what you've got. You're looking at the signs and symptoms related to the actual chief complaint. So this is where we're going to do our sample. Right? Have they got any allergies? Have they got any medications that they're taking? Any past medical history? This is sort of some of the detective work that you want to be doing to actually find out what's actually going on, particularly with medical cases, that sort of thing. Trauma, it's pretty much you can see and treat. Other stuff like medical, like cardiac related or respiratory related, you're not sure until you actually start ask the questions. All right. Last time they had any oral intake, so last time they had a drink. And events leading up to the actual incident. So what were they doing at the time? How did it happen? What were they doing? Like for cardiac, were they sort of walking or on an exercise, or were they just resting, or all that type of thing. So you want to be sort of asking those type of things and sort of basically sort of going through the whole scenario, and that gives you your main items or so you want to be looking at. Alright guys, that's your initial assessment. Next we'll go on to the secondary assessment. Cheers.